So folks, I've discussed in details about the introduction to pharmacology and routes of drug administration in my previous videos. It's time that we move forward to learn some of the basic yet most important topics of general pharmacology. These are pharmacokinetics and pharmacodynamics. So let's start with pharmacokinetics. What is pharmacokinetics? In pharmacokinetics, we ask questions like how does the drug get into the body? Where does it go? What does the body do to the drug? And how does the body get rid of the drug? So let's begin with pharmacokinetic acronym ADME, where A stands for absorption, that is how does drug gets into the body. D stands for distribution, where does it go in the body. M stands for metabolism, that is how the body modifies the drug. And E stands for excretion, that is how the body gets rid of the drug. Okay, so I have decided to break down this tutorial into 4 parts on each aspect of pharmacokinetics. In this tutorial, we are going to learn about absorption. So, what is absorption? Absorption is the movement of the drug from its site of administration into the circulation, that is, the bloodstream. Now, we have already discussed the various routes of administration of drugs, which completes almost half of the part we are going to discuss in this tutorial. So, I highly recommend you to go through my detailed video on routes of drug administration. Moving on with the factors affecting absorption, not only the fraction of the administered dose that gets absorbed, but also the rate of absorption is important too. Except when the drug is given IV, where it does not have to cross the cell membrane because it is injected directly in the bloodstream. The absorption of the drug is governed by other principles too. These include aqueous solubility. Water solubility helps the drug dissolve faster. For instance, a drug given as watery solution is absorbed faster than the same drug given in its solid dosage form. Concentration. In cases of passive diffusion, the drug given as concentrated solution is absorbed faster than from diluted solution. Area of absorbing surface. Larger the surface area, faster is the absorption. Vascularity of the absorbing surface. More vascular is the organ, faster is the absorption. Finally, the routes of administration. This affects drug absorption because each route has its own peculiarities. So what are the unique features of oral route of administration? Let's begin this by understanding this equation. Let's say AB is a drug, which is in its unionized form right now, which dissociates reversibly into A plus B minus. Understanding the fact that unionized form of the drug is lipid soluble, that means it can cross the cell membrane, and ionized form of the drug is polar and hence it is water soluble. So, in order for the drug to be absorbed, it has to be in its unionized form. Which thereupon takes us to the first important point of the oral route, that is, acidic drugs, example aspirin, are largely unionized at acid gastric pH and are absorbed from stomach, while bases, example atropine, are largely ionized and are absorbed only when they reach the intestines. Let's understand this into a bit more details that why and how is this happening? Why acidic drugs are unionized in stomach and bases unionized in the intestines? Let's say you have taken aspirin, that is a weak acid, through mouth. It goes into the esophagus and then to the stomach. And we all know pH of the stomach is very low because of the increased H+ ion secreted by the parietal cells. Assuming that the unionized form of aspirin is HA, which dissociates reversibly into H++ A- until the equilibrium is reached on both the sides. Since there is more H+ in the stomach, H+ is going to combine with A- and will form HA, so the backward reaction will be facilitated. Hence, the more unionized form of aspirin is in the stomach. Therefore, it is absorbed in the stomach, which helps us conclude that weak acids are absorbed in the stomach. Similarly, taking an example of basic drug atropine, assuming the unionized form of which is BHCO3, which is going to dissociate into B plus HCO3 minus until the equilibrium is reached. Interestingly, there is more bicarbonate in the intestines, especially in the duodenal region. So, more HCO3 minus will combine with B plus, forming BHCO3, which is an unionized form of the drug, and hence unionized form of the basic drug will be absorbed in the intestine, which concludes us saying that weak bases are absorbed in the intestine. Now, another thing that I couldn't afford to omit out in the oral route of drug absorption is the concept of PGP, that is P-glycoprotein. So, what is PGP? PGP is an efflux transporter that is located in the gut epithelium. What does it do? Have you ever wondered why the oral absorption of certain drug is low? Because a fraction of the absorbed drug is extruded back into the intestinal lumen by this efflux transporter PGP. So, there can either be inducers of the PGP or inhibitors of the PGP. Talking about the inducers, for instance, rifampicin or phenobarbital. If PGP is induced, that means the drug that comes in, more drug will go out, so the oral bioavailability of the drug will be low. In contrast, the inhibitors of the PGP like quinidine or verapamil will not let the drug move out which already came in. Therefore, more drug will be available for the action and hence the oral bioavailability of this drug will increase. So we have to make sure to adjust the drug dosage if the drugs that induce or inhibit PGP are given simultaneously. The next one is the subcutaneous and intramuscular route. In both the cases, the drug is delivered directly in the vicinity of capillaries. I already told you about the nerves and blood supply in both the regions in my tutorial about routes of drug administration. Let's briefly review it here. The subcutaneous layer underneath the skin is richly supplied by nerves and is less vascular as compared to the intramuscular route, which have more blood vessels. So, the drug will be absorbed rather slowly in the subcutaneous route as compared to the drug injected in the intramuscular route. The last one is the drug absorption through the topical sites, that is skin, cornea, and mucous membrane. Systemic absorption after topical application depends primarily on lipid solubility of drugs. To get more insight on the topical administration, again, you can go through my previous tutorial on routes of drug administration. So this completes our section about absorption in the pharmacokinetic series. Thank you, everyone. I hope you enjoyed my video. If you did, please click on like, subscribe, and share. Spread the love. Keep safe and keep healthy.
Bye-bye for now.